Well, fantastic. Thank you very much indeed, Richard. Could I ask Helen, please? Helen, lovely, you're there. And could I also ask Duncan if he could join? Now, sadly, the technology has beaten Richard. He was having to follow on his phone, and he sent us a message. But what I would just pass on, that he has said one of his comments would have been to recommend that everybody watches what he described as a brilliant speech this morning from John Kerry. And I think he's going to send us the link, and we'll make sure that that's circulated to those of you on the call. So many thanks again to Helen and Duncan, two fantastic presentations. There's one question that is probably relevant to both of you that's come up, which really relates to actually measuring decarbonisation. And of course, that's relevant to the NHS. It's also relevant to cities. And I wonder, Helen, if I could come to you first and see if you'd like to comment on that in NHS context.
I saw that going past, and I'm sorry, I have no expertise in how this is measured. I just know there are clever people spending a lot of time doing this, but I honestly am not the right person to answer the question. I'm not going to try and blag my way through that. I am trying to work out how to post some links in the chat, and I'm going to do that because I promised in my talk to post some links. So I'll concentrate and see if Duncan has got any more intelligent answers than I have.
No, that's okay, Helen. Maybe one of our technical colleagues can help you with that on the WhatsApp. Duncan, I don't know if you have any comments in relation to that.
It's a great question. I think it's its heart as well as about the fact that the developed world has outsourced a lot of our carbon emissions because production of many of the goods upon which we rely for our daily lives is to be found elsewhere around the world, and particularly, of course, in China. And to the extent that I talked about the deindustrialization of Glasgow, we've seen that offshoring of our own emissions because production of basic goods doesn't always take place in places like Glasgow, nor indeed for our food, and far too much of which arrives or used to arrive in the bellies of aircraft, where seasonality and the resilience of much shorter local supply chains was not obviously at the top of people's lists. A couple of things I'll say. First of all, in terms of measurement, I don't want to go into too much technical data here. I feel fairly confident, for instance, about real-time air quality data, which you can pick up on the Scottish Air Quality website from Glasgow with quite accurate emissions data. When it comes to carbon emissions, it's really quite difficult as a city to get a hold of that. We, as a council, have quarter-hourly meter readings of gas, electricity, and we know that diesel or whatever used in our vehicles as we obviously look to decarbonise them. So we've got a good idea of our emissions. As a city, I can tell you we get our emissions data 2 years in arrears from the UK government department BEIS, because it takes a lot of people with a lot of algorithms and math, so to speak, to get that, because it's just a really difficult business. As a result of which, our 2020 target for carbon emission reductions was achieved a few years ago, but actually our 2020 data won't be available for another year or so. And so we've been trying to get around that because we know we need to get much closer to real-time emissions data in order especially to work out whether some of our policy interventions are having any kind of difference in terms of traffic flow, for instance, heat and so forth. And we have actually been working with the University of Strathclyde and with colleagues from the Bay Area of California, from Stanford and Berkeley, in fact, to try to get monitors in Glasgow that will give us much closer to real-time emissions data. And that's a good example, I think, of where the town-gown relationship, which is well known to any colleagues from public health, comes to the fore. Just one final thing there, and a big shout out for our friends at the Glasgow Centre for Population Health. I think the model there of research, policy and practice in an iterative and reflective fashion, which brings people like me from public policy into contact with people from public health, is absolutely vital. And for sustainability, something very similar is needed, I believe, where we get the people who have the data with the people who are engaged in public policy and with our citizens together. And that model, I think, is one we really want to see replicated.
That's brilliant, Duncan. No, thanks very much. Thank you. One other question that is probably, again, relevant to both of you that's come up in the chat relates to remote working. So the remote consultations from a medical perspective, but also remote working and the future of city centres and so on. So Helen, I wonder if you would like to comment a little on that from a medical perspective.
Yes, certainly. I haven't spotted that particular question. I was looking at the family planning one, actually. But look, remote consulting. So there's the basic things about the pandemic has accelerated trends that were already there, and remote consulting throughout healthcare was already a trend that was happening. There was a huge demand for it, particularly from younger digitally enabled people, and clearly not a demand from it from those affected by the digital divide and certain other groups. And we've had an incredible live experiment in how it works. And in some ways it works brilliantly, and in some ways it's dreadful. So we have to be very clear as we go forward to let's cash in the corona bonus, as they say. Let's get the good stuff. We've now got the infrastructure, which was a big problem throughout healthcare systems throughout the 4 nations of the UK and indeed worldwide. We've got the tech now. We've got a population that has become used to doing it. And so I regularly consult by video consultation with 90-year-olds in the quite middle-class town where I live, and where I work, as a GP. But there are so many things that I fear as a healthcare professional that remote consulting is not allowing me to do. And an anecdote perhaps makes some of you smile. I teach communication skills to medical students, or I used to anyway, and I used to talk about being a 5 senses consultant. Now, I have never licked a patient or tasted a patient in my life, but I listen, I touch, I feel, I smell the patient as they walk in the room, but I also have a 6th sense, which is the totality of the experience when you see a whole person and you connect with them on many levels. So that's the 5 senses, just for the avoidance of doubt. And of course, we are sensory impaired when we consult remotely. We cannot, as the 3 of us here, cannot see the 165 participants who are on this webinar right now. We have no idea who's snoring, who's angry, who's jumping up and down with excitement. And as a clinician, I know that I'm doing a poorer job in some cases than I would otherwise do when the person's in the room with me. So the right place at the right time. Of course, remote consulting gives us massive green advantages, but also there are other ways of seeing patients and enabling people to travel better. Getting consultants from secondary care out into the communities they serve can save 20 people traveling to one clinic, which is a great bonus, but it still allows that face-to-face interaction. So review it carefully, look at the evidence, learn from the pandemic, use the infrastructure we've got. But even remote consulting and digital consulting has a carbon cost. And I had a wonderful comment from somebody a short while ago, which is that every Instagram post that Ronaldo makes uses the same energy as a household for a year. I mean, some sort of mad statistic, it might be complete urban myth, but the point being that there is a cost to digital usage as well. I'll pause.
Yeah. That's great, Helen. Thank you. And Duncan, would you like to add anything in relation to cities?
Yeah, absolutely. A couple of things. Obviously, there's a whole issue prior to COVID that we were discussing anyway about e-services and the digital delivery of public services, particularly given pressures on those very services. But there's also a sense, I think, secondly, if I may address this through my resilience lens, of what it means in terms of an issue that had arisen with us for consideration prior to COVID and has been amplified all the more during the crisis around increasing levels of loneliness and social isolation. To give you an example, our household predictions in Glasgow, based upon household type, is that single person tenure will become the principal housing type within the next 20 years. That's an extraordinary change to our very existence, particularly in an urban setting. And what it means, of course, at a time of retrenchment of public services, we will find ourselves in loco parentis if families and communities don't look after each other. And so you start from an issue that sounds maybe a little bit wishy-washy to some people about loneliness, and you end up with a very profound challenge, aside from the obvious moral and ethical issue of wanting to look after each other in terms of mental health and well-being anyway. And so there's a big issue there, I think, for me, in terms of remote working, the extent to which you break down existing social networks. And cities are places where fundamentally people get together, and people can be as anonymous as they want. They can be on their own. This is why cities attract LGBT communities historically, because you can do things in cities that perhaps where once you lived, you'd have found more difficult. But equally, they can be places of anomie and isolation. And I think that is going to become an increasing issue for all of us, even whilst we acknowledge that remote and digital forms of engagement are quite useful. Just on a very practical basis, finally, if I may, Jeremy, the leader of the council, Susan Aitken, has compassed the world several times over via digital platforms to talk to other cities and mayors around the world in preparation for COP, and will be welcoming many of them in person over the coming fortnight. And that has been interesting because, to have put her on a plane would have been much more difficult in terms of carbon emissions and public perception. If there's one thing I've learned from going around the world by digital means, it's that captures a universal value of every city. It's that no member of the public, the taxpayers, wants to put a politician on a flight anywhere. and maybe subsequently to all of this, they may turn out to be right.
Well, thank you both very much. I mean, I'd love to go on for ages. I mean, tremendous answers to questions so far, but I think in the interest of time and the trainees competition, we will have to draw a close now. I'd like to thank all of those who've spoken and participated tonight. I'd like to thank Adrian and the team at the college who've put this event together. Now, of course, it isn't entirely over yet, the event. So as part of the college's activities, as you'll know, they set up a competition for our trainees seeking proposals on an intervention or a quality improvement project that could improve sustainable working within the NHS. That event will start in about 5 minutes' time after a short break. Those of you who would like to stay, we'd be delighted for you to stay. If not, can we thank you very much for participating, and those of us involved with the competition will kick it off in 5 minutes' time. So thank you all very much indeed.
Thanks, Jeremy.
Thank you.